Hi, good morning, sir. My name is Kate. I'm your student nurse for today. So, we are going to conduct a simple history taking and head-to-toe physical assessment for your wellness checkup and also to update your medical records. So, it is rest assured that all the information gathered here in the assessment is well kept and private and confidential. So, is there anything you want to ask, sir?
No?
So, if none, we have provided a examination gown for you to change in so it is much more comfortable. And if you have the urge to urinate or to void, you may do so before starting the examination. So, while waiting for the patient to change into a hospital gown, provide the client's privacy by providing a partitions or divisions or whatsoever available in your institution. After providing the client's privacy, perform hand hygiene by washing your hands and prepare all the equipments that we're gonna use for the assessment. Okay, sir, be seated. So, overall general appearance, the client is clean and properly groomed. The client is dressed also appropriately for the weather. Currently, the client is in a hospital gown, sitting upright and posture erect on the edge of the bed. So, we will assess for the vital signs, which are the temperature, the blood pressure, the pulse rate, the respiratory rate or respiration, and the fifth vital signs, which is pain using a pain scale. So, first, we are going to assess the temperature using a thermometer. Sir, is it okay if you put this under your underarm? So while waiting the thermometer, we're gonna do or assess the pulse rate and the respiration. After assessing the respiration, the pulse rate, get the thermometer. So, sir, is it okay if you get the thermometer? Then we will assess for the blood pressure. Sir, alam niyo po ba yung dati ng blood pressure?
Oo.
Ano pong range niya?
120/80. So, after assessing the vital signs, the fifth sign, the pain. So, sir, are you feeling any pain right now? Oh. So after assessing all the vital signs, document all the information or the data gathered.
So we need to assess the mental status of the client. So as you can see, the client is alert and cooperative, conversant, and the speech of the client is clear and appropriate without stuttering or shaking. So, sir, can I ask you to smile? Can I ask you to frown? Can I ask you to make sad face? So as you can see, the client is able to express his feelings clearly using facial expression. The client is also able to maintain eye contact during conversation and follow all verbal commands. And the client remain attentive and focus on the given task. So also, we need to assess the cognitive status of the client. So sir, who is the current president of the Philippines?
Rodrigo Duterte,
Do you know what day is it?
Wednesday,
Do you know what date is it?
May 13, 2020,
Sir, do you know where are you right now?
hospital,
So as you can see, the client is able to orient the place, the date, and the place where he is right now. So sir, what did you have for breakfast this morning?
coffee with bread,
What mode of transportation did you use in going here?
motorcycle,
The client's short-term and long-term memory are intact based on cognitive assessment. So, in taking the body measurement of the client, we need to assess the height and weight, the waist and hip circumference, the mid-arm circumference, and the tricep skin fold thickness, which are being used to calculate the ideal body weight, the BMI or the body mass index, and other measurement ratios. So, the records shows the measurement of the client's body. So, after assessing the mental status of the client, we need to assess the skin, hair, and nails. So, the skin of the client is fair and evenly distributed. There is no skin lesions and wounds, and the skin is intact. Sir, is it okay if I touch your skin?
okay,
So, the client skin is elastic and mobility is good. It is warm to touch. It is smooth and moist. There is no edema when putting pressure. And that the skin is thick. So, the hair of the client is evenly distributed and black in color. So, sir, is it okay if I check your hair?
okay,
So, the scalp of the client is dry. The hair of the client is brittle. And there is no presence of alopecia or hair loss. So, we need to assess the nails of the client. Sir, is it okay if I assess your nails?
okay,
So, the nails of the client is clean and properly groomed. It is pink in color. The nails are hard. There is a presence of lunula in the nail bed, and when put pressure, the color comes back within 3 seconds. So after assessing the skin, hair, and nails of the client, we proceed to the head and face assessment. So overall general appearance, the head of the client is in the midline, not in the sideways. It is upright and circular in shape. The face and the features are both symmetrical. So sir, can I ask you to smile, to frown, to puff cheeks, to raise eyebrows? Sir, is it okay if you close your eyes? And tell me whether I touch your left or right side of your face.
left, left, right, left, left, right, left,
So, sir, thank you. Open your eyes. So, the client is able to follow the verbal commands and also to express it through facial expression. So, the client is also able to determine whether it is the right side of the face or the left side
which is the assessment for the cranial nerves, 7 and 5, which is the trigeminal and the facial nerves.
Sir, is it okay for you to move sideways so it is easier for me to assess? Are you feeling any pain?
Wala.
Sir, is it okay if you open your mouth 2 to 3 times? Sir, thank you. There is no bump and swelling in the temporal area, and the temporomandibular joint or the TMJ movement is smooth and there is no swelling. So, in assessing the eyes of the client, we need to use the Snellen chart. So, sir, can you see the Snellen chart in front of you?
Yes.
Can you read the 8th line?
Yes.
So, sir, can I ask you to cover your right eye with your right hand? And please read the 8th line.
D, E, F, P, O, T, E, C.
So, sir, can I ask you to cover your left eye with your left hand and please read the 8th line?
D, E, F, P, O, T, E, C.
So, the vision acuity of the client is 20/20. So, now we will do a confrontational test. So, I'll be putting my finger in front of you and you will look straight forward. Please follow my finger using only your eye. Okay, so now we will do a test for the corneal reflex. So, sir, I'll be putting this. Ano ba to? Drop. Ano to?
Go.
So, now we will do a confrontational test. So, I'll be putting my finger in front of you and please look straight forward. So, please follow my finger using only your eye. So, now we will do a test for the corneal reflex. Using this eye drop. So, the visual acuity of the client is 20/20 based on what he had stated before using a Snellen chart. The visual field of the client is good by confrontation and the client is able to follow the verbal commands, which indicates that the cranial nerve 3, 4, and 6 are intact. The corneal reflex is evident upon assessment and the extraocular movement of the eyeballs is smooth and intact and there is no ptosis noted. So, upon the assessment of the external structures of the eye, the eyebrows and eyelashes are thick, black, and evenly distributed. There is no redness or discharges in the lid margins of the eye. Sir, can you close your eyes? Can you open your eyes? So, the eyelids is able to open and close without difficulty. The conjunctiva is still moist and warm to touch. The iris is dark and the sclera is white with noted blood vessels or blood vessels in the lateral aspects of it. So, sir, please look straight forward and I will dim the light to test the internal structures of your eye. So, I will assess the corneal light reflex of your eye. So, sir, please look straight forward and I will gonna pass this light using this pen light.
Okay, sir. First I'm gonna open the knife. Please look straight forward. So, assuming that I'm using an ophthalmoscope for testing. So, upon assessment, the corneal light reflex is present and visible. We also noted that the pupils are evenly rounded and reactive to light accommodations. The pupils reacts and constricts up to 3 mm. It is also noted that the iris is uniformly black by the endoscopic examination, and the red reflex is bilaterally evident. So now we're gonna assess for the ears. So, assuming that I have an otoscope for testing to inspect the internal aspects of the ear. So, sir, is it okay if I inspect the internal structures of the ear? So, the external structures of the ears are symmetrical in both sides. Bilaterally, the auricles without informity, lesions, or lumps. The mosaic process and auricles are non-tender upon palpation. Bilaterally, also the auditory canals contains a little brown cerumen, and the tympanic membranes are pearly gray and transparent without budging for retractions. The bony prominent on the tympanic membrane are also noted as visible. So sir, I'm gonna whisper some words from this distance and please try to figure out what it is.
Okay. Hi, hello. Hi, hello.
So assuming that I will be using a tuning fork for testing. So sir, I'll be putting this tuning fork in your head and please tell me if you still felt the vibration both in your left and right ear.
Okay.
Can you still feel the vibration?
Yes.
Is the vibration still there?
No.
So as the next test, sir, please tell me if you still feel the vibration on each side of your ear. Can you still feel it?
Wala.
Can you still feel it?
Wala.
So it is noted that the patient can distinguish the 3 syllables words at the distance of 3 feet in the whisper test. Based on the Weber's test, there is a equal lateralization of sounds in both ears. And based on Rhine's test, the air conduction is greater than the bone conduction in both ears. So there is no deformity, symmetry, and inflammation. The turbinates in the middle meatus are pale pink without swelling and exudates conditions. It is noted that the nasal septum is in the midline without bleeding or perforation. So now we will assess for the patency of airflow and the sense of smelling. Sir, I will occlude one nostril at a time. Please tell me if you still have a good airflow. Yeah. Thank you, sir. So now we will gonna assess for the sense of smelling. So sir, please close your eyes and I will give some scents and try to figure out what scent it is. I will upload one nose strip. So sir, please close your eyes.
Alcohol. Perfume. Scented oil.
So sir, okay, thank you. So the patient is able to identify the presented scent of alcohol, perfume, and oil, meaning that the cranial number 1 is intact. It is also noted upon palpation of the sinuses that the frontal and maxillary sinuses are non-tender. Now we're gonna assess for the mouth and the throat. So overall general appearance, the client has a facial hair around oral mucosa, and the lips are pink, moist, and smooth. There is no ulcerations or lesions noted. Assuming that I'll be using a tongue depressor for the testing. So sir, can you stick out your tongue? Sir, say ah. So sir, I will be putting pressure and please try to resist it. Below the tongue. Right side. Left side. Pinky sir. So upon assessment, the tongue is in the midline, there is no deviation noted. The buccal mucosa is thick and moist with light pink patches over the tongue. There is no ulcerations or nodules noted. The gums are pink and moist without bleeding and inflammation. The hard and the soft palate are also evident without lesions or masses. The ovula is in the midline, and when the patient was asked to say ah, it elevates. The tonsils are also present without exudations or ulcerations. It is also noted of the presence of the gag reflex, which indicates that the cranial nerve number 10 is intact. It is also assessed of the presence of the tongue strand, which indicates that the cranial nerve number 9 and 10 are intact. It is also noted that there is no difficulty in swallowing. So now we're gonna assess for the taste sensation. Sir, please close your eyes and I'll be giving a condiments and please try to figure out what it is. Sir, please stick your tongue.
Salt. Sugar. Calamansi.
So sir, what taste is it?
Sour.
Okay, thank you sir. Please open your eyes. It is noted that the patient can distinguish the presented taste of sugar, which is sweet, salty for salt, and sour for calamansi, which indicates that the cranial nerve number 9 is intact. So now we will proceed to the neck assessment. So overall appearance, the neck is symmetry and placed in the center of the body. So, sir, can I ask you to follow my commands?
Okay.
Can I ask you to hyperextend? Chin to chest. Ears to both sides of the shoulders. So, as you can see, the client is able to follow the command and the movement of the neck is smooth and there is no complaint from the client. So also, we need to assess the trachea and the thyroid gland of the patient. So, sir, is it okay for you to move sideways? So the trachea of the patient is in the midline of the neck, and there is no bumps or swellings palpate in the thyroid gland. So after assessing the trachea and the thyroid gland of the client, we need to assess and palpate the lymph nodes. First is the preauricular nodes, the postauricular nodes, the tonsillar nodes, the submandibular nodes, the submental nodes, the occipital nodes, the superficial cervical nodes, the deep cervical nodes, the posterior cervical nodes, and the subclavicular nodes. So, there is no bumps, there is no swelling, and there is no tenderness. So, next, we will assess for the arms, hands, and fingers. So, sir, is it okay if you extend your hands?
Okay.
So, is it okay, sir, if you put your hands outward, inward, upward, downward, downward? Can you rotate your hands counterclockwise? Clockwise. So, okay, sir, thank you. So next test, sir, can you extend your elbows? Can you flex your elbows? Extend, flex, extend. So, sir, can you flop your wrist? Can you move your fingers? So, sir. So, thank you, sir. So, now we're gonna test the bilateral sensations. So, sir, please close your eyes while I'm trying to put some pressures on some areas of your hand, and please distinguish whether it is right, left, or both sides.
Left, left, right, both, right, left, both.
Okay. Thank you, sir. Please open your eyes. So, next, we palpate the brachial, radial, and the ulnar pulses. Okay, thank you, sir. So, assuming that I'll be using a percussion hammer for the reflex testing. So, sir. Okay, thank you, sir. So, is it okay, sir, if you move sideways?
So, sir, I will be putting pressure on your shoulders, and please try to resist it by lifting your shoulders. Okay, thank you, sir. You can back. So, sir, I will be putting pressure from this side, and please try to resist it. This side. Okay, thank you, sir. So, upon assessment, the upper extremities of the arm are equal in size and symmetric with no deformities noted. The skin is brown, warm to touch, moist, and there is no lesions or bumps noted. It is also noted that there is a scar on the left upper arm of the patient indicating the previous vaccination. So, upon assessment of the brachial and the radial pulses, they are positively equal and the lymph nodes are not palpable, specifically the epitrochlear nodes. So, the shoulders, elbows, wrist, and finger joints, roams are full and without limitations. The muscle tones are intact without tremors or weakness. Upon the assessment of the palms, it is pink and warm to touch. The capillary refill time is less than 2 seconds. So, upon assessment of the reflex, such as the biceps, triceps, and the brachioradialis, they are all evident and present. So, sir, so for this test, can you extend your hands? Move your palms up, down. Do it as fast as you can. Okay, sir. Alternately. Okay, sir. Thank you. You can. Sir, can you put pressure to your fingers using your thumb? Do it as fast as you can. Thank you, sir. So, sir, for this test, you need to close your eyes and I will give something or put something in your hands and please try to guess what it is. So,
Ball pen.
3,
Eyeglasses.
okay,
Cotton.
okay. Thank you, sir. You may open your eyes. So, sir, for this test, you need to close your eyes and I'll be writing a number on your palm and try to guess what number is it.
8, 4, 3,
Okay, so other side.
5, 1, 2,
Okay, sir. So, for another test naman po is I'll be touching a finger and you need to lift one finger where I'm gonna touch it. Okay, sir?
okay.
Okay. Thank you. You may open your eyes. So, upon assessment, it is noted that there is a proper hand coordination and fine motor function are still intact and evident. So, there is a bilateral sensations of light touch and pain sensations in the upper extremities as we did earlier. Stereognosis and graphesthesia are present and still intact. So now we will assess for the posterior chest and the lateral chest. So sir, I will just open the back of your gown for the assessment for the posterior and the lateral chest. So sir, can you move sideways?
So upon palpation, the back is warm and moist to touch. There is no budging or retractions. So now palpate the tenderness, sensation, crepitus, or lesions. So sir, please say 99 while I'm putting pressure on your back.
99, 99, 99, 99, 99.
Okay sir, thank you. So it is also evident upon palpation that the scapula and the shoulder blades are symmetrical in both sides. The spine is also aligned in the midline. And upon palpation, the tactile fremitus is evident and present.
Go.
So now we're gonna percuss tones and determine the diaphragmatic excursions. So, okay, sir, take a deep breath and exhale. So, take a deep breath and exhale everything that you have inhaled. So, next, take a deep breath, sir, and hold your breath. Exhale. So, okay, sir, thank you. So, now we're gonna auscultate for breath sounds. So, sir, take a deep breath. Exhale. Inhale. Exhale. Inhale. Exhale. Inhale. Exhale. Inhale. Exhale. Inhale. Exhale. So, thank you, sir. So, the respirations are even and unlabored. It is regular, and as you can notice, there is no movement or use of accessory muscles, and the spine is aligned posteriorly. So, the scapula is symmetry in both positions. The skin, as what I have stated before, is brown and fair, without tenderness, lesions, and masses. And the thorax extends symmetrically without retractions or bulging. So it is also noted that there is a bilateral tactile fremitums. So upon percussion, the percussion is resonant throughout by diaphragmatic excursions. Using a pen and a ruler, measures 4 cm by equal bilaterally. So the vesicular sounds is heard in all lung fields. The bronchobascular sounds is heard near the sternal area, and the bronchial sounds is heard over the scapula. So there is no adventitious breath sounds such as your croakles, robs, or wheezes was noted. And upon assessment of the heart sounds, they are regular in rhythm and rate. So now we will assess for the anterior chest of the patient. So sir, can you move back to your position earlier? So, sir, we will gonna assess for your anterior chest. So, we would need to remove your gown for this assessment. Is it okay, sir? So first, we need to inspect the anterior-posterior diameter of the chest. So looking at it, the anterior-posterior to lateral ratio is 2:1. So now we need to palpate for any tenderness, sensations, lesions, or any masses in the chest.
So sir, I'm gonna check for the chest expansion of your chest. So please inhale and exhale. Inhale. Exhale. Inhale. Exhale. Inhale. Exhale. So, okay, thank you, sir. So now we're gonna auscultate the anterior chest of the patient for any heart sounds using a stethoscope. So sir, inhale, exhale, inhale, exhale, inhale, exhale, inhale, exhale. So, thank you sir. So now we need to assess the heart. So, thank you sir. You may bring up your gown. So, as what I have mentioned earlier, the anterior-posterior to lateral ratio is 2:1. So, as what I have mentioned earlier, the anterior-posterior and the lateral ratio is 2:1. So, as noted, the slope on the rib of the angle of Louis is 40 degrees. Skin color is brown, no tenderness, no swelling, no lesions, and no juice palpated. Just like the posterior chest, respirations are even, unlabored, and regular. There is no use of accessory muscles, and there is no nasal flarings during respirations. The thorax expands symmetrically without retractions or bulging. There is also noted the bilateral tactile fremitus. So upon percussion, there is a resonant sound throughout the lung fields. There is also a dullness over the heart. The vesicular breath sounds is throughout the lung fields. The bronchovesicular breath sounds is noted over the sternal borders, and the bronchial sounds is noted over the clavicles. So, there is no adventitious breath sounds such as the crackles, rubs, and wheezes noted over auscultations. It is also noted that when you pinch the skin in the sternal border, there is a presence of good skin mobility. So when you assess the anterior chest of the patient, you won't be able to find a way for the heart or the cardiac assessment. So upon assessment of the cardiac status of the patient, the apical pulses are palpable in the sternal wall. The heart rate also is regular, and the rhythm wherein the S1 and the S2 sounds are also regular. There is no S3 or S4 sounds noted, as well as murmurs or gallops and other external sounds beyond the S1 and the S2 sounds. So now we will be assessing the abdomen of the client. So sir, is it okay if you lie down for this assessment? So sir, I will be exposing your abdomen part for this assessment. Is it okay, sir?
Okay.
So only expose the part we're gonna assess or what part you're gonna be assessed for. So first, we need to inspect and palpate the skin and the umbilicus area. So upon assessment the abdomen, it is rounded and symmetric without masses or lesions. The abdomen is also free from bruising or swelling or any inflammations. It is also noted that there is a minimal hair in the hypogastric area of the abdomen. There is also no evidence of varicose veins in the umbilicus area, and the umbilicus area is in the midline. There is no lesions, bumps, or any discolorations noted. So now we're gonna auscultate for any vowel sounds. So sir, I will auscultate using my stethoscope for any vowel sounds. Is it okay, sir?
Okay.
Okay, thank you, sir. So, vowel sounds are present and active. The gurgling sound is noted at 20 per minute. It is also noted that they are low-pitched sounds upon auscultation. So now I'll be assessing for the arteries. So upon assessment, the aortic, renal, and the iliac arteries are without fluids. There is no friction rubs in between the organs upon palpation or inspection. So sir, I will just stop my fingers on your abdomen and try to listen to the sounds. Thank you, sir. So upon percussion, the abdomen is tympanic. However, there is a dullness over the liver, the spleen, and other body organs within the abdominal cavity. There is no tenderness noted in the abdomen. Okay, sir. I will put some pressure on some areas of your abdomen, and please tell me if it is painful. Okay, sir? it painful, sir?
No.
Okay, thank you, sir. So, upon assessment, there is no tenderness as what I have stated before, and masses noted for the light and the deep palpation. It is also noted that the liver and the spleen are not palpable for this case. So now we're gonna assess for the lower extremities of our patient, especially the legs, knees, and the feet. So first, we need to inspect the lower extremities. So sir, is it okay if I'm gonna assess your foot or feet?
8.
Thank you, sir. So upon inspection, the patient has a symmetric lower extremities in sizes and in shapes. The skin are also intact. It is brown. It is warm and moist to touch. And there is no lesions or swelling palpated. There is no bruising and there is no inflammation. So now I'm gonna palpate the inguinal and the femoral areas of the patient. So sir, I'm gonna palpate. Okay, thank you, sir. So, now we're gonna do a heel to shin test. So, okay, sir, before you sit down, could you please, excuse? So, could you please put the heel of your feet to your knee on the other side, then slide it downward. Again. Again. Okay, the other side, sir. Again. Again, sir. Okay, thank you, sir. You may sit down. So now we're gonna assess for the reflex of the knees of the patient, doing a Achilles reflex test. So, assuming that I'll be using a percussion hammer for the testing. So sir, I'll be doing a test. So, the other side. Okay. Yeah, okay. Thank you, sir. So, the femoral, the dorsalis pedis, the popliteal, and the posterior tibial are positive to equal bilaterally without tenderness or swelling upon palpation. The capillary refill time is less than 2 seconds, equal bilaterally. The muscle tone is intact with no atrophy and tremors or weakness. So sir, can you swing your right leg? Your left leg? both legs. So, sir, okay, sir. Any difficulty?
No.
Okay, thank you, sir. So, the muscle strength is 5/5 on both lower extremities. And upon the assessment of the reflexes, the patellar and the Achilles reflexes are both evident. However, the Babinski reflex is absent because it is expected in the developmental stage of our patient. So, the patient can also perform the heel-to-shin test without any difficulty, as what have you had seen before. So, sir, for this test, please close your eyes and I will try to put some pressure on some areas of your lower extremities, and please try to figure out if it is right, left, or both sides.
Okay.
So, please close your eyes, sir.
Right. Left. Right. Right. Left. Both. Left.
Thank you, sir. You may open your eyes. So, the superficial light and the sharp sensations are intact, and the precision sensations of the toes are evident. So, sir, can you stand up? So, now we're gonna assess for the musculoskeletal and the neurological system. So, sir, can you bend forward? So, okay, sir, you may stand up.
Go.
So, as you can see, the posture of the client is erect. There is no spinal deformities such as scoliosis and other deformities. So, sir, I need you to walk about 3 steps to your right. Your usual walk. Okay, sir. Okay, sir. And back to the left side. Okay, thank you, sir. Okay, sir, you may sit down. So, as you have noticed, the gait is steady, smooth, and coordinated with even pace. So, there is a full, smooth, coordinated range of motion on the upper and the lower extremities. As you can see, the upper extremities can swing freely while walking. So now we're gonna do a heel to toe walk test. So okay, sir, please stand up. So sir, I need you to walk with your toe near the heel of your feet. Okay, sir.
Okay.
Okay, sir. At the back, at the other side. Okay, thank you, sir. As you would notice, the heel-to-toe walk of the patient is intact, and there is a good balance to the patient. So, sir, the next step to be performed with your balance is hopping on one leg and alternately on the other side. Okay, sir? Please raise one leg, then hop 2 times. Okay, sir, the other side. Okay, thank you, sir. So, the patient can hop on one leg without difficulty. So, the last standing test to be performed by the patient is the Romberg's test. So, sir, please close your eyes. So, I'm gonna count 1 to 20, and please put your feet together, heels together, hands on the both sides, and okay, I'm gonna start. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20. Okay, sir. You may open your eyes. Thank you, sir. As you would notice, the patient has a negative of the Romberg's test. Although the patient is a little bit shaky, but it is concluded that it is a negative on the Romberg's test. So, as the last test, sir, we need to do a finger to nose test. So, sir, please put your left finger in front of you and try to hold your finger then to your nose and do it as fast as you can. Okay, sir. The other side, the other finger, sir. Right side, then do it. So, okay, sir. Thank you. So, as you would notice in the finger to nose test, the patient can perform without difficulty. So, sir, thank you. That's all for our head-to-toe assessment. You may sit for a while. Okay, thank you, sir. So, after the assessment, we need to wash our hands, document all the findings, and if there are abnormalities noted, we need to make unnecessary referrals.